Hi, my name is Craig Prince, and I welcome you to Understanding Medicare and How It Works. We're going to go over to help you create an understanding of the ways that you can receive your Medicare. So I can receive my Medicare benefits one of two ways. I can choose to have Medicare be a claims payer. This means that if I use Part A or Part B of Medicare, it literally is the federal government that's paying my claims. Again, there are gaps that Medicare has in their claims paying. For example, if I go into the hospital and I am hospitalized for 5 days, I'm going to pay the first $1,600 worth of hospital expense. That is a gap. But Medicare is going to pay the rest of it. Literally, the federal government is going to pay the rest of my claim. The second way I can receive my Medicare benefits is to have Medicare be the premium payer. In other words, Medicare is going to pay an insurance company to provide my Medicare benefits, if you will. The insurance company will be the one that will be paying the cost of the benefits, because they're receiving a premium to do that. So let's kind of look at this as Medicare being the claims payer. If Medicare is a claims payer, if you will, the federal government will pay the inpatient hospital costs. They will pay the skilled nursing costs. They'll pay for the blood transfusions. They'll pay for the hospice care, the physician's fees, including surgeon, assistant surgeon, and anesthesiologist. They'll pay for outpatient radiology, which will include your x-rays, your MRIs, your CT, PET scans, ultrasounds. It will pay for durable medical equipment. Medicare will pay for prosthetic devices, for hospital outpatient, including emergency room. They'll pay for your ambulance expenses, whether it's ground or air. It's going to pay for Part B drugs like chemotherapy. It's going to pay for inpatient, outpatient mental health. It's going to pay for certain preventative items like immunizations. And I'm sure I'm leaving some out. But this is where Medicare, if you will, the federal government, literally is the payer of the claims. Second way I can receive Medicare as a premium payer. In other words, this is where, and you can see on the bottom, where the federal government, I've put a drawing of the Capitol building. They literally pay an insurance company to be my Medicare coverage. And of course, the insurance company then is required to pay all the costs that we just talked about. And I've listed this, the insurance company being the payer of those items, with the exception of hospice care. If I receive my benefits through a plan where the federal government is paying that plan a premium, we call it Medicare Advantage. If I need hospice care, Medicare directly will pay for the hospice care. Otherwise, the insurance company is the payer for all other items. And item number 14 is really important, because these Medicare Advantage plans pay for items that are not paid for by Medicare, like eyeglasses, hearing aids, gym memberships, chiropractic care, acupuncture care, and a myriad of other items. And so understand that these items are not Medicare covered items, but they are items that the insurance companies have chose to create a plan designed to pay for those items, which means not every Medicare Advantage plan is going to look like every other Medicare Advantage plan. So what do I need to do if Medicare is a claims payer? Well, I'm going to need to pick up a policy called a Medicare Supplement or a Medigap policy. It's an insurance policy written by insurance companies to pick up portions of what Medicare Part A and Part B don't cover, or that they leave you to pay. And of course, premiums vary based on age and location of where you live. This little chart below gives you an illustration. Literally in the early 1980s, Medicare standardized all the Medicare Supplement, Medigap policies, and they called them, if you will, by the ABCs also. So don't get confused. Medicare Parts A, Part B, Part C, and Part D. Those are parts of Medicare. But if you hear a Plan A Plan B, a Plan C, or a Plan D, those plans are called Medicare Supplements. And this chart really gives you an illustration of what those items typically cover. Okay? Also, you would need to pick up a prescription drug plan, what we call Part D of Medicare. And of course, plans can vary in price based on several factors like deductibles, copays, formulary size, in other words, how many drugs are offered, and the location of where you live. So, what do I do, or what do I need if Medicare pays an insurance company to be my Medicare coverage? Well, I must be covered by Medicare Parts A and B. I must choose a Part C Medicare Advantage plan that's available from where I live. I am guaranteed in this benefits that are going to be equal to or better than original Medicare in terms of the scope of coverage. And I am going to be restricted by the rules set up by Medicare and the insurance companies that offer these plans. This little chart that I have below, confused about Medicare, really, when it comes to Medicare Advantage plans, the basics of Medicare Advantage plans and what they cover are going to be very similar to what Medicare does, hospital, medical expenses, and those items. But how they choose to have pay in terms of your share of cost can vary from one plan to the next. And the component that a lot of people like within these plans, which is the fact that they don't have to have a separate drug plan. Also, what the drugs that are covered under that plan and how they're covered can vary from one company to another. So that's why I've got down in the illustration on this chart an arrow that points towards me, Craig Prince from CAP Insurance. I've been helping people to understand Medicare and to understand what their choices are for over 45 years. If you want to quote out your own health insurance, I've got down here below on the bottom of this slide, go to craig.easymedicare, spelling easy, E-A-Z-Y, Medicare.com. You can actually quote out your own Medicare coverage and using parameters. You can play around with it before you talk to me so that you can kind of get a feel for maybe for what you like, and I can help also answer questions. Also, you can go to www.medicarewithcap.com. When you get to this site, you'll see a video that will come up called the A, B, C, and D's of Medicare. I welcome you to watch this if you have not watched it. It's available right on that website. Also, I've given you the contact information. The first number is my cell phone number, which I have with me all the time. I'm available whenever you need me, unless I'm in a meeting. And you can call us toll-free at 800-570-3330. Always look forward to being of service.